Veterans, did you know the VA is to give veterans 1 year authorization to seek care from private providers in 30 different specialties? In today's video, I'm going to show you an article that breaks this down. Make sure you stick around. Hello, everyone, and welcome back to my channel. My name is Dwayne. I got a video for that Kimball, United States Army veteran and retired VA rating specialist. Before we move forward, make sure you go ahead and click that like, subscribe, and notification button. The VA is to give veterans 1 year authorizations to seek care from private providers in 30 different specialties. That's what I'm going to be sharing with you today. But before I get into today's video, make sure you click the link in the description section and get signed up for my upcoming webinar, Unlock Your VA Disability Compensation Benefits. It's going to be on the 26th and 27th of August from 6 p.m. to 8 p.m. Eastern Standard Time. So let's go ahead and get into this article. Here you can see VA to give veterans 1 year authorizations to seek care from private providers in 30 specialties. I've only used community care once, okay, just one time. But if you're a veteran that has used community care multiple times or even one time, leave me a comment and let me know what you think about community care. All right. So we all should know who this gentleman is. It is Mr. Collins. He is the Secretary of the VA. He is testifying before Senate committee. He spends a lot of time up there. Okay. All right. So, all right, we'll start here. So, veterans seeking care in the Department of Veterans Affairs Community Care Program in 30 specialties will not have to get reauthorization from the VA for a year under a new policy announced by the department Monday. Now, one of the issues that I've had with community care, the one time that I've used them, they reached out to me and they said, "Oh yeah, we see the private provider that you saw is requesting a referral to another medical provider." So then the community care person said they canceled the appointment. Community care person called me and was like, "Hey, we had to send a referral over to them." And I'm just like, "Oh my God, you got to be kidding me," right? So still waiting on them to get back with me. It's been over a month, but I did reach out to my primary care so they could send another message over to them. All right. So for a whole year. So when I was looking at this and I talked to community care, every time you go out, you got to get a referral, or you may get a referral for like 5 visits, 10 visits, or whatever the case may be. But now it is good for 12 months. So that should put a lot of you veterans at ease that often use community care. All right. It states before the change, which went into effect Monday, and this article was from August 4th. Okay. And I'm recording this on August 11th. A little bit behind. VA community care specialty referrals were reevaluated every 90 to 180 days, according to the department. That's a lot of work, people. That is a lot of work. Here it says, no veterans should have their health care disrupted by red tape, VA Secretary Doug Collins said. Now, this is obviously something new that the VA is doing, and time is going to tell. Okay, time is going to tell. So again, if you're a veteran, you've used community care in the past, and now, you've had a lot of referrals, and now you continue to need more referrals. Let me know, hey, what do you think about community care? I know I'm going to get a lot of mixed reactions. Okay. Says the community care program allows veterans in the VA healthcare system to get care from community physicians or health provider if they meet certain eligibility requirements, or the VA is unable to provide timely or sufficient care. We're going to get into that. They did talk about that. Okay. But before we get into this time limit, let me know. Again, I know I'm asking you a lot of questions because I'm curious. Like I said, I only use community care once, but let me know the distance. So you got a referral, you got to approve for community care. How far were they sending you? Now, when I talk to someone in community care, I'm like, you all sent me like 35 minutes away. Wasn't that bad. First time I went, had to run some errands in that area. And the second time I didn't. And I was like, this is kind of far. You don't have anything in between. And what she told me was, well, there's a lot of providers out there, but it's not a lot in this particular specialty in your area. So I'm like, so can you give me, if I give you my zip code, can you give me some within 15 miles? She said, yeah. And I found one like literally 10 minutes from my house. And she was like, would you like me to move you? So I was like, well, give me a second. And I went to Google, read some of the reviews, and I was like, nope. And so I was like, well, if you could email me that list, I would like to check the background. And she was like, yeah, I can do that. Super simple, right? So, time frame. Under the program, veterans can go to private doctors if they must wait more than 20 days for a primary or mental health care appointment at the VA or face a drive of 30 minutes or longer. For specialty care, the standards are a 60-minute drive or 28-day wait. All right. So actually, I was talking to a dentist and he was like, yeah, we can't get you in within 28 days. We got to get you uh, community care or a 60-minute drive. Those are for veterans, I'm assuming, that are in very remote locations. Okay. So I had a veteran tell me, he's like, man, I signed up for dental. Veteran said, I got 100% permanent total. And I went in for my cleaning and they said, we can't get you in for like 6 months. I was like, what? And he told him, he's like, well, what about community care? Don't you have some standards around that? And they left out the room, came back, and it was like, hey, can you come in 2.5 weeks? He was like, sure, I can do that. I'm like, why didn't they just tell you that the first time? All right. So goes on to say, to get community care referral, a veteran must get approval from a VA physician and authorization from their VA facility. Okay. You must go through your VA primary care. Let me know if you were able to get a referral from somebody other than your primary care, VA facility. Okay. In the past 6 months, the department has taken steps to ease the process. Whew, thank you. That removes a requirement that a VA physician's referral to community care be reviewed by another physician or VA administrator for approval. That is going to reduce that wait time. Okay. Especially with some of these job cuts, because we know the majority of the job cuts came under the VHA side, Veterans Healthcare Administration. And for those of you that may not know this, there are over 450,000 VA employees, okay? Because you got NCA, National Cemetery Administration, then you have VBA, Veterans Benefit Administration, and then you have VHA, Veterans Healthcare Administration. All these individuals that they're talking about are under VHA, which has over 400,000 of those employees at all these three departments under the VA umbrella. All right, let's keep going. Now, it will allow veterans to stay in community care for 1 full year before needing a reauthorization. People, I'm gonna give you a word of advice. If you are in community care and you fall into this 1 year, make sure you put on your calendar on that 11th month, you need to be logging in to My Healthy Vet or va.gov and log in and go to My Healthy Vet and emailing your primary care. Hey, I'm coming up on my 12 months. What do I need to do to get a reauthorization? And maybe they started over from that date, those 12 months. Okay. Now, I'm not going to go through this entire article. Okay. But it's starting to make sense to me. All right. It states we are alarmed by the volume of concerns we are hearing from veterans and VA staff who attribute limitations on care in the community to lack of funding for VA. All right. I haven't really gotten into the whole funding side, like how much or what is the budget for VHA. I haven't even went down that. I haven't went down that rabbit hole. Okay, so this was an extensive article. Again, I'm going to put the link to this article in the description section. So if you want to come and go through, scroll through, as you can see, it's a lot of information. But I did want to cover this part. Okay, this is key. Under the new 1-year reauthorization policy, veterans will not have to get another authorization from the VA in these 3 specialties. Okay, cardiology, dermatology, neurology. All right, so here are all 30. All right, so I'm just going to scroll down so you can see them. Neurology, nutrition. Okay, oncology, eye care examination. Okay, orthopedic, hand, orthopedic general, orthopedic spine, pain management, podiatry. All right, but I'll put the link to this article in the description section so you can go and you can check it out. All right. Okay. Again, I think the VA is making strides in different areas. Keep in mind, this is a large federal organization. Change takes time. When they implement that change, they still have to work out the bugs. Okay. But one key thing that I took away from this, I stated earlier, if you're a veteran that uses community care and you get that 1-year authorization, don't wait until 11 p.m. on that 12th, within that 12th month, and you're sending that email to your primary care physician. You need to be doing that a month before that 12-month is going to expire. Okay. Nothing with the VA happens quick. You may get lucky from time to time, but this is something that you do not want to leave to chance. Also, this is under VHA, Veterans Healthcare Administration, not VBA, Veterans Benefit Administration. I only worked under VBA. Another veteran sent me this article. I did some research on it, and I was like, oh, let me share this with other veterans because they need to know this information. Any additional information, you need to reach out to your primary care physician that's on your team or the social worker to get additional information. With that being said, make sure you like, subscribe, hit that notification button, and as always, share this video with your fellow veterans. Thank you.